Now, this is a very interesting question that came in, and I'm curious as to the person who submitted this. What's a common trick in Medicare marketing that hides restrictions on doctors' choices? So, here's what you want to ensure when it comes to your selection of doctors and whether and how they are covered by your plan. And it depends on the type of plan that you have. If you have a Medicare Advantage plan, most of them are Medicare Advantage prescription drug plans where the drug plan is part of the same plan. And there are HMO plans and there are PPO plans. Regardless of whether it's an HMO or a PPO, those are still network plans. With an HMO, you must stay in network. That has nothing to do with how the plan is marketed. It's how the plan is designed. You have to stay in network if it's an HMO plan. With a PPO plan, you do have more flexibility that you can go out of network, but it will be at a higher cost to you. So you want to ensure your doctors are in network either way. Now, again, with the PPO, you can go out of network, but it will be at a higher cost. So I don't necessarily recommend that. And you also want to ensure that any and all specialists that you see are part of the same medical group and network that your primary care physician belongs to, because everything is going to be based on your primary care physician in an HMO plan. Slightly different with a PPO plan, because again, you can go out of network, and as long as the doctor is in network within the plan on a PPO, you can still see that doctor and it will be considered an in-network visit. On an HMO, you do not have that same level of flexibility. So there are doctors who are just affiliated with one medical group, and then there are doctors who are affiliated with multiple medical groups. If your doctor is affiliated with multiple medical groups, you need to decide which medical group you want to be associated with your specific plan, and all specialists that you see have to belong to that same medical group. It can't be a situation where your doctor has 3 different medical groups and you can see any and all specialists of all the medical groups and be considered in-network. The in-network charges will be based on the specific medical group that your doctor is affiliated with. So you want to make sure that if they have multiple affiliations, that you are choosing the one, if you are seeing various specialists, that you are choosing the one that most, if not all, of your doctors belong to. This is on a PPO. Again, on an HMO, you're restricted to the network. So there's no marketing ploy, no marketing tactic. It's just something that is based on the structure of how the plan is designed. And it is up to you to make sure that your doctors are going to take the plan, that they're contracted with the plan, that your doctors are in network, not only your primary care physician, also known as PCP, and any and all specialists. That's with the Medicare Advantage plan. There are also Medicare supplement plans, MedSup, also known as a Medigap plan. Now with these plans, you can see any doctor as long as the doctor takes Medicare. There are a few exceptions to that, but that for the most part is the case. There is a large medical group, I won't name any names, but they do everything internally. They do not take Medicare supplement plans, so that would be an exception. Even though they see Medicare patients, they have their own Medicare plans designed. The doctors are employed by that medical plan, employed by the insurance company. So that's a different variation, but in most cases, a doctor who takes Medicare will take a Medicare supplement plan. There's no networks of doctors you have to worry about there. You can, again, see any doctor as long as they take Medicare. I hope that answers your question and belays any concern related to any trickery. There really is no trickery around doctors and doctors' networks. It just really depends on how your plan is structured. You can access your summary plan document. It would have the type of plan that you're enrolled in. It should say on your card as well, whether it's a Medicare Advantage plan, HMO plan, Medicare Advantage plan, PPO plan, or a Medicare supplement plan. Those are basically your choices when you are on Medicare. And the person who helped you enroll should be able to assist you with any further questions specific to your doctor's network, And I hope that belays any concern around any potential trickery around how plans are marketed. Have a great day. Bye-bye.